care has really become a heated debate. A pretty heated debate. I think you feel pretty passionate about your health care, don't you? And we have, as I said, we've had great town halls. And let me give you a little synopsis of some of the things that we have heard. You do not want government controlled, government financed, government insured, government mandated health care.
Right.
Calling our offices and emailing and faxing and showing up at our meetings are telling us they do not want a federal government bureaucrat making their health care decisions. That health care and medical care decisions should be made by doctors and patients and families and not by a bureaucrat in Washington. What you want us to do is to come up with something that is patient-centered, that is consumer-driven, and you want less government interference at the end of the day. You know that, and this is from one of the ladies at one of the town halls last week. She said, I know that care delayed is care denied, and that's the same thing as good old-fashioned rationing, and I'm not going to stand for it. So I think most of you agree with me on these principles, that we need to reform. You know that health care is too expensive, and that we need to come up with some policies that are going to get the cost down. We sometimes forget how expensive it is, and when that bill lands in your lap from the doctor's office, you look at it and you say, oh my goodness, something needs to be done about this. Let's do it in a patient-centered, consumer-driven way. You know there are times that we have restricted access. Some areas of the country have difficulty holding doctors, having access. We know that there are problems with access when it comes to Medicaid, when it comes to TennCare. We know, and God bless our men and women in the military, we know that there are some issues with TRICARE that need to be dealt with. And we know definitely that there are some access issues with Medicare that need to be addressed. So those restrictions on access are impediments and they need to be removed. We know there needs to be insurance accountability. If you have a pre-existing or chronic condition, you need to be able to get into the affordable private insurance market. And that is something that needs attention now. We also know if you have a health insurance policy in good standing, and if you get sick and you need that health insurance policy policy needs to pay the bill without delay. They need to do that right now. We know that portability is an issue. Once you have a policy, you ought to be able to keep that policy regardless of if you change jobs. And we also know that there has to be some liability reform that addresses malpractice, that addresses frivolous lawsuits. So we have to get serious about liability reform. Now, since I have been in D.C., I've had the opportunity to call on, work with, and study with some pretty good policy experts. And when I want to think past the words that are on a piece of paper and a piece of legislation in front of us, sometimes I call those experts. Now, when Medicare modernization took place in 2003, I did exactly that. Amazing thing. I read the bill. My summer reading this year has been this bill. But I read the bill, and then I called on one of our nation's foremost health policy experts to help answer the questions. And that is Dennis Smith. Dennis was the director, the administrator of CMS, which is the Center for Medicaid and Medicare Services. He since has become the senior fellow at the Heritage Institute, and he is leading the team there that is doing research on health policy research, and I am so thrilled that today he is here to join me so that together we can answer your health policy questions. So join me in welcoming to Franklin, Tennessee, Mr. Dennis May.